Hello guys, this is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and today's video is all about comparing diploma in anesthesia versus MD in pathology. The reason I'm doing this video is after you get a bigger rank like 30,000 above, you wouldn't get MD in anesthesia. So you might get diploma in anesthesia in a good college. Along with that, you might have an MD pathology as an option. So many people have requested me which one to choose. So I'm going to give my personal recommendation and opinion based on some facts which I'm going to show you now. You can see on the screen what I'm going to show you is the kind of mindset and work-life balance that you have in both the specialties I would like to compare, and earning potentials I would like to show you. And then I also would like to show the future prospects in both diploma in anesthesia as well as MD pathology. And I would like to show you abroad opportunities with both the specialties. And then I would like to show some of the threats that these specialties would have in future, which will help you in taking a very informed decision. Okay, and then my conclusion I would like to show you. And then also made a rough math about setting up a lab, because whoever wants to take up pathology, if they're ambitious, they would want to set up a lab, right? So what will be the cost of setting up a lab, and what is the kind of profit margin you get, how many samples you need to do. Also I calculated roughly, I would like to show you so that you get an idea about, if you're an entrepreneur mindset, if you are entering pathology with the mindset of setting up a lab, then you need to know these calculations actually. Okay, so all these things I would cover in this video. It would be pretty lengthy video, but the thing is, like, you need to invest your time in this video if you are in a confusion between these two specialties. Okay, so the first and foremost thing I covered in the video is work-life balance. The reason being, the main reason people go into pathology is because of this. There is no doubt in that pathology will have a superior work-life balance compared to diploma in anesthesia. The reason being, diploma in anesthesia, you would be working in night shifts. You also would be working in high tension zones, you're giving anesthesia and all that. So comparatively, pathologist would have any day a better work-life balance. A more structured day, 9 to 4 job is guaranteed. Okay, if somebody is working more than that, they might be working in some corporate, some emergency, analysis of a slide or something would be there. But otherwise, you work in any kind of a private medical college, I would tell where all places you can work. In all those places, it will be mostly 9 to 4 job. But in diploma anesthesia, it is not guaranteed, because if you're working in ICU, you might be in a night duty or in a morning shift or a 12-hour shift. So many irregular calls and shifts would be there. So that is the work-life balance aspect. Here, pathology is scoring any day higher than diploma in anesthesia. The nature of work and the mindset I would like to cover. The nature of work in diploma in anesthesia is it's a clinical specialty. So if you think anesthesia is a non-clinical specialty, you are mistaken. Anesthesia is a clinical specialty. You interact with patients from morning to night. You give anesthesia, you talk to them, you extubate them, you manage them in the ICU. If you're an intensivist, then thing is, like, you will be all the time talking to patient relatives, and it's a clinical specialty area. Understand that. So diploma in anesthesia, so direct patient care is involved, and it will be more dynamic. And since it's an acute care setting, it would be dynamic and fast paced. Okay, you need to understand that. So you need to be good in decision making, crisis management, and you need to have some kind of a collaborative team. You should act like a team member. Leadership and all those things would be required if you're choosing anesthesia. If you're going into pathology, then you're more like, you have to have an analytical mind and a detail-oriented mind. So because you have to analyze the microscopic slides, and you should be having a very broad knowledge about different specialties of medicine, because you need to analyze the slide from a particular disease. You have to understand the clinical situation of the patient, and then you need to interpret. So here it is more like, if you're introverted, analytical, detail-oriented person, go for pathology. So that is what I can do. You can sit with your microscope and spend good time and understand and get the diagnosis of the disease. So this is the difference in the mindsets which are required in both the specialties. So if you are a team person, extroverted, and then you want to be in action, go for diploma in anesthesia. If you are introverted, and then if you want to mind your business, and then if you are attention detail oriented, go for MD pathology. Earning potentials, if you compare, earning is slightly different between both the specialties. I would like to tell you. Let me first cover diploma in anesthesia. See, if you ask me the initial salary, I actually don't know what to tell, because a diploma in anesthesia candidate can freelance, can work in private medical college, or he can actually join uh, kind of a small nursing home setup. So every area he gets a different salary. The problem with diploma in anesthesia is will come here. If he is applying for an academic institution like a private medical college, their MDs are more preferred, because now surplus of MDs are being produced. Around 4,000 plus MDs are coming out every year. So they will be preferred there. So my recommendation is, if you are diploma in anesthesia, don't go for academic position. Try to actually be in like nursing homes and freelancing practice, where MD and diploma doesn't matter. It's all skill based. Okay, initially some importance they will give for MD candidate, but the thing is, if a diploma person is having very good skills, he will be given priority. But in academic institutions, it's not like that. You have to go according to the degree wise. So if the person's degree, if a DM comes, an MD will not have much value. So if a foreign fellowship person or somebody comes, then maybe they will almost on par or slightly superior to DM, would a consideration would be given. So it is all hierarchy is based upon the educational qualification. But in freelancing and the nursing home practice, what happens is the skill of the person, how he talks to patient relatives, how he does the high risk cases, how he actually maintains relationship with the surgeon, how efficiently he does the operation with minimal medicines, and also how efficiently he runs the operation, and how he behaves with others, and all these factors would score very high. And here personality matters more than degree. So that is what I recommend. And in tier 2 and tier 3, if you go to tier 4, the diploma would be more preferred, because they actually are, they can hire diploma people for a lesser salary. So coming to the numbers, anywhere between 80,000 to 1.5 lakh you can earn in a nursing home as a salary. And if you are doing freelancing, it will be based on the cases. So for a general anesthesia, anywhere between 3 to 4,000 you will get. So if you do 1 or 2 cases in a day, you can earn anywhere between 5 to 10,000, and 2 plus lakhs you can earn in a month. So that is, if you're doing 4-5 cases in a month, you will earn 4-5 lakhs. That's a different story. But in reality, around 2 to 3 lakhs you can easily earn in any place. So this is where MD pathology will have some issues, because MD pathology, mainly people would be people choose MD pathology would choose it with a mindset to have a balanced life. So they prefer to enter medical colleges like private and government. So there the scales are totally different. So anywhere it can range between 80,000 to 1.2 lakhs is the salary that they would get in a private medical college. Government, based on the pay scale, it would be slightly higher, but it will be slightly more, but it's a fixed scale. You can't cross these scales with MD pathology. But here the game is changing, because the DMs are coming up in pathology. I will show you now. With these DMs, you can actually scale up to higher levels. I will show you how. So coming to the future prospects and specializations, in diploma in anesthesia, you can go for IDCCM, which is 2-year course after diploma in anesthesia, or regional anesthesia fellowship can be done in Ganga Hospital. They allow diploma candidates. You are eligible for EDAC. If you do diploma in Pakistan, you don't have an eligibility for EDAC, but in Indian diploma, you have eligibility for EDAC, and you can do PD set and upgrade to MD. So these are different pathways that you can take after diploma in anesthesia. After MD pathology, the pathways are even more high. You can go for DM. In India, DM oncopathology is there, DM clinical hematology is there, DM hematopathology is there. So oncopathology would have more demand in India and abroad, I feel. So if you're choosing for DM, go for this. And you can stick on to your pathology core specialty, and also you will be hired in bigger cancer centers like Tata, and the place where I am working, Naster, also a big wing of onco is there. You would be hired in such kind of centers. You can conduct a lot of research. You can demand a good salary. By default, by doing DM, you will enter DM scale in all these bigger corporates. So whatever DM cardiology initial candidate gets, even you get the same package. So you start with a higher salary. That will anywhere range between 2 to 2.25 to 2.3 lakhs. So that is one advantage of going into DM in oncopathology and all that. DM clinical hematology is more about blood disorders like leukemias and all that. Here you will have a clinical practice here, and then you can work and in pediatric oncology sections, and you can build your own practice also. This is also a very good future specialty for MD pathology. And DM in hematopathology also is there, almost like the similar thing. Leukemias, bone marrow transplant locations and all that, they would be there. So these are different DMs. If you do, your pay scales can go cross 2 lakhs also. And after that, there might be a ceiling, because all these are service sectors. No, there might be a ceiling, but your pay will be more. And then there are so many fellowships actually, like neuropathology, gastropathology, renal pathology, cytopathology, immunohistochemistry, cytopathology, and all that. So many fellowships are there. And so even a lot of abroad opportunities also coming with these fellowships. I would like to show you. You can see here, in Australia, latest website I have seen, speech pathologist is whom they are wanting in their particular position. It's considered hot, and then it's immediate. So such kind of fellowships are there. Why I'm trying to tell you is, if you are a pathologist, you have a lot of abroad opportunities also, which is the next section in our discussion. Okay, so let me cover the abroad opportunities of anesthesia first. If you do diploma in anesthesia, you can go to USA, but you have to do residency again. You have to go through MLA route. If you want to go to UK, you can write EDAC and then apply for a GMC registration, and then you can go for training if you select. Otherwise, you can actually work in any hospital with the EDAC and diploma degree. But if you have DNB, they are valuing more, okay, because DNB they recognize. Diploma directly they don't recognize. If you have EDAC, your chances are higher, but I recommend do a DNB after that and then go to UK. But even without that, you can try with EDAC. Okay, Australia, you won't be eligible for a specialist pathway. Only the MD anesthesia people would be eligible for that. You'll have to go through standard pathway and have to clear the AMCs and then get the ANSCA. Okay, so coming to pathology, since you are MD pathology, you can go into pathology residency after finishing, but you have to clear USMLE. And in UK, they have something called as FRC path. If you do that, you can get jobs in UK. And Australia, you will be eligible for specialist pathway. And also subspecialties like oncopathology and all are in demand in Australia. And I've shown you before, speech pathologists are required. So if you venture into subspecialties in pathology, your chances of getting into abroad would be easy. So these are the different abroad opportunities with anesthesia and diploma anesthesia and pathology. So finally coming to the threat that these specialties have. So the threat is that, the diploma main threat is the limitation in the career growth compared to an MD. The reason is, if you want to do cardiac anesthesia, neuro anesthesia, transplant anesthesia, only MDs are eligible. That is the main problem in India. And the second thing, even IDCCM, whatever I told in the video in the beginning, are only in 4, 5, 6 centers. Rest of the IDCCMs, they wouldn't take diploma candidates. They will ask for an MD or DNB. And then the work. So if you want to get into academic career, then it's a challenge only. It is very difficult. So that is the problem with diploma in anesthesia. But a solution is very simple. Go into PD set and do the DNB, and then you can get into any of the things. That is how you have to plan. MD pathology, the threat is AI. So advances in the AI will not replace pathologists. So many pathologists will get mistaken by listening to this. You will not replace pathologists, but workforce reduction will surely happen, because if AI is incorporated in your slide analysis, maybe instead of 10 pathologists, 2-3 pathologists can run the show, or one pathologist can run a big center with the help of AI in future. And the main problem with pathology is, in diploma anesthesia, once you finish your education, if you plan to do freelancing, you don't have to read much. But in MD pathology, you have to continuously keep reading, stay updated, because new technologies would be coming, new flows. They will tell flow cytometry, immunohistochemistry, and some new thing has come. So you have to keep reading about all the new diseases which are coming. You have to keep updated about all the technologies also which are coming. So the continuous reading pressure would be there in MD pathology. So to conclude my opinion, I will tell you. So my opinion, I'm going to tell you based on your mindset and ambition. Try to understand. So if you're a less ambitious person who want work-life balance, okay. So there are many of us like that, right? So you have to choose MD pathology here. Plan to get into government or private medical college, you will get that. You can spend time with your family. There is no wrong in that. That is a very good thing. And that too, I don't want to mention the gender bias will come again. So if you want to have a less ambitious and work-life balance in your life, go for MD pathology. If you're an ambitious person and you can still take a pathology with a franchise laboratory model, I will explain the math behind the success of a pathology lab after this. That can be done. If you plan to stay in tier 1 cities, do DMs. Corporates would love you. And then if you want to go into international, abroad, do DM. Okay. And the main problem is there is no clinical exposure. It is a non-clinical specialty. It's unlike anesthesia, which is a clinical specialty. If you're okay with that, go for pathology. No, I don't. I want clinical exposure, and I have to be with the patients. I'm okay with the night calls. I'm okay to manage crisis. Then welcome to anesthesia. Join the league. Diploma is fine since you can do PDSET and DNB later on. You can do IDAC and go to UK also, even if you don't want to do PDSET and DNB. Fellowships and other fellowship in regional anesthesia, if you do along with diploma, that will be a good synergistic combo to do freelancing. You can give a lot of blocks and all that and finish cases very safely in freelancing practice. So that is, if you want to do freelancing, do diploma, do regional anesthesia fellowship, start your freelancing. In tier 3, tier 4 cities, it would work. And if you want to come to cities, then go for IDCCM, and then a 2-year course it would be, and then you can set up your base in some ICU. But the decision to choose diploma is mainly based on the rank that you have. If you don't have MD anesthesia, if you don't want to take MD anesthesia in a private medical college, go for diploma, no problem. After that, prepare well for PDSET and do DNB, that's it. But the only problem here, I already highlighted in my last video. If you have not see my last video with Nitin and me discussed, DA DNB in Dubai and Abu Dhabi, they are creating some issues now. They are not allowing. So you need to, maybe it might change in future. If you're watching this video 5 years down the line, okay, this is 2024, okay. If you're watching this in 2029, they might change the rules in future. But at present, they're not taking up DAD and B. That is a bad news. So, but Dubai and Abu Dhabi is not the only place in the world to live, right? You can stay in India, no? So many ways are there to stay in India. So don't worry about only one thing and take a call. So let us finish the presentation by showing the math behind running a pathology lab. Pathology lab, if you want to set up, how much money do you require to set up? So you have to buy microscope, hematology analyzer, centrifuge, microtome, flow cytometer, and PCR machine. Total 1 crore you have to spend on all that. It's not easy. Infrastructure, you need laboratory renovation you have to do to a place. If you can't buy it, and then real estate and all that would be another 1.5 crore. And since at least if you cut down, if you have a place, even if 1 crore loan, if you apply with interest rate of 10%, you need to pay EMI of 1,65,000 per month. Got it, no? So your expense is 1,65,000. Not only that, your monthly operating costs would be there. Minimum 1 to pathologists, you have to hire lab technicians, administrative staff. 3 to 6 lakhs you have to shell out for monthly, along with the 1.5 lakh of your loan interest. So total 7 to 8 lakhs it will come. And then consumables and reagents you have to buy. That will be around 1.5 to 3 lakhs. And equipment maintenance, AMCs you have to pay for the equipment, and calibration you have to keep doing. That will be another 1 lakh. And electricity, water bill, internet bill, rent, and all that will be another 1 to 1.5 lakh. So total marketing expenses, licenses and all you have to maintain, no? Even that. If you take everything, then the total expenditure, even if you don't have an EMI, your own building, you have already equipment, even without loan, you need to spend 8 to 13 to 14 lakhs per month. And with loan, solid loan, if you're taken of 1 to 2 crores, then around 10 to 18 lakhs of monthly operating cost would be there. So you have to earn above that to earn profit. So the revenue breakup, if you do minimum if you need to, okay, so to break even, you need to minimum around 22 lakhs you have to earn per month, so that you make some profit out of it. Okay, so for example, around 15 to 16 lakhs is your operating cost. Then at least 18 to 19 lakhs if you make, at least 2-3 lakhs profit you will make initially. For that, how many samples you have to do? You need to monthly minimum of 1200 to 2000 samples you need to do in a day. 47 to 88 samples per day. So 88 samples should come to your laboratory. When you analyze, you'll just break even. If you do 100 plus, you're safer. So on an average, any laboratory in India, the average in the sense, if you are in the hospital, it's a different story. But if you have set up a franchise of labs, and then you have connection with local hospitals, so I think you might get anywhere between 30 to 50 samples. So you'll exactly break even. So if you want to run it, you have to run it very efficiently. Efficiency in the sense you have to cut down all those things, cut down the number of doctors, cut down the number of nurses, run it efficiently, and then with less samples also you might be able to run. That is what business is, right? So if you do like that, you might make some profit. And if you are doing more samples, if you are more enterprising, more people are sending lab samples to you, either because you have some equipment which you don't have, or you have some expertise, or you are giving some kind of a fees to them, and then your center would click. And then if you're doing 100 plus samples in a day, you will make crazy amount of money. So this is the math you need to know before setting up a pathology lab. Okay, because if you are a pathologist and if you want to set up a lab, this is the mathematics behind that. So I hope I covered everything, right? So now you need to take a call, and I've given my recommendation also on how you have to choose between these two. So thank you guys. And so my channel, many people are in WhatsApp, they want to join. So it is it is full somehow. I am requesting people to exit the channel so that more new people can attend. In the discussion group, daily we'll be discussing some area. Sometimes we'll discuss about Middle East opportunities. Sometimes we discuss about in the India only what are the better opportunities, what are super specialities after certain specialities like MD general medicine, what are the super specialities you can do, what are the different career paths. We'll be discussing all that. So I'm thinking this WhatsApp is not working out. I might shift to Telegram so that I can accommodate more of you guys there. I might shift and give that link in future. And so that's the next plan. So thank you guys. Thank you for following. Good luck for your counseling. It is coming very shortly now. And that is why I had to do this video. And I think this video will help many of you guys. And I hope many of you take up anesthesia. And I will be your mentor. Don't worry. And we will work together. We'll build our CVs in anesthesia or pathology in future, and then we will settle in different parts of the world, and in India also we'll settle in a very good position in future. Okay, thank you very much. Thank you all for following the video.